Well, as a person that's had other jobs, I can definitely say that waking up and planting a seed, especially for somebody who hasn't seen like plants growing and stuff like that, planting a seed a week ago and then coming back and seeing a little sprout, or planting, watering something and coming back and seeing it sprout more, or cutting like pruning tomatoes and coming back and see it grow better. It's really gratifying as like it gratifies me as a person, not only to know that I'm the work that I'm doing is actually doing something, but to also see like it going toward places in my community, because I live like everybody that works here lives like maybe 5 to 10 minutes away from here, and I've seen the food and the garden and stuff aid people in my community, and it's nice to see. Um, Usual jobs, especially jobs for an 18 to 19-year-old boy, you don't get to affect your community like that, or help families in need, and that's just really nice to see. It makes all the hard work and working in the hot, it makes it worth it.
Good afternoon, everyone. My name is Sarah O'Connor, and I'm a program manager in the MCW Office of Community Engagement. I'd like to welcome you to our February edition of our monthly series, CE Spotlight. Please note that this session is being recorded. I'd like to begin with a statement from the Office of Community Engagement. We wish to acknowledge the Indigenous people who are past and present stewards of the land on which we pursue our just cause of a healthy community for everyone. To our audience members, please be sure you are muted throughout the presentation. We encourage everyone to use the chat bar freely to share comments or post questions for our guests. We will be monitoring your questions throughout the session, so feel free to send any as they come to you, and we will also set some time aside at the end for Q&A. We hope that you will continue to join us for future Spotlight presentations. They take place on the second or third Wednesday of each month. Please look for information about upcoming guests on our CE website, and you can also find our webpage by Googling MCW CE Spotlight. This monthly series features community partners and the important work they are doing for and with the community. We highlight their goals, motivations, and accomplishments, and the ways they have partnered with people and programs here at MCW. Today, we are deeply honored to have Nurse Jenny Ovide and Pastor Dan Czaplewski as our CE Spotlight guests. We would also like to thank a faculty member on our community engagement team, Dr. Brian Johnston, who is serving as facilitator today. At this time, I would like to introduce our Senior Associate Dean for Community Engagement, Dr. Stacy Young, who will say a few words about Nurse Jenny and Pastor Dan's important work for the community and their partnership with MCW. Dr. Young?
Hello, everyone. Thank you, Sarah. I don't know about others, but I really enjoyed the opening to this afternoon's spotlight. It always warms my heart when I see so many of the wonderful photos and see the work that's happening in our community, and a great musical selection as well. So thank you very much for that. It's my pleasure to say a few introductory words about Nurse Jenny and Pastor Dan. Jenny is a registered nurse and currently serves as the Community Medicine Clinical Coordinator at the All Saints Family Health Center and has been at the center for the last 20 years. And I'm proud to say I've known her that long as a dear colleague. Her work there combines creativity, health education, and community engagement, and has created programs for family medicine residents, medical students, patients, and community members. The clinic hosts a garden, a collaborative farm with Mount Calvary, and has a workout track and a newly constructed greenhouse. An important focus of the clinic is addressing social determinants of health, in particular food insecurity. Family medicine residents and medical students work alongside Jenny in the garden, delivering food, assessing patients for food insecurity, and holding healthy cooking and tasting classes in the teaching kitchen. Nurse Jenny is constantly learning how to make the community a better place in more ways than just addressing physical health. She finds it a humble challenge to listen to the community's needs and help find ways to tackle the complicated and important issue of food insecurity and its effects on health. The clinic garden is a collaboration with Mount Calvary, where her work intertwines with Pastor Dan. Pastor Dan is the pastor at Mount Calvary Lutheran Church in Milwaukee. He has been in Mount Calvary since 2013 and has also served in parishes in Florida and Oregon. He has taught or served as principal at schools in Wisconsin, Missouri, Oregon, and Florida. Mount Calvary Lutheran Church established the Mount Calvary Community Development Corporation in 2016 as a separate nonprofit corporation. Pastor Dan is involved in their signature program, Farm to Hospital and Community, that works in conjunction with Ascension St. Joseph's Hospital and Ascension All Saints Family Health Center in Milwaukee. The program operates an urban farm that provides fresh, naturally grown vegetables to at-risk communities while also developing their intern program and workforce. Pastor Dan is married to Sarah and has two grown sons, Seth and Luke. They live in Milwaukee, where Sarah teaches in Milwaukee Public Schools. I would now like to introduce today's facilitator, Dr. Brian Johnston. Dr. Johnston is an assistant professor in the Department of Family and Community Medicine. Additionally, he holds faculty appointments with All Saints Family Medicine Residency and with the Office of Community Engagement. Dr. Johnston is a family doctor and medical educator. He sees patients and teaches residents and medical students at the All Saints Family Medicine Residency Program and St. Joseph's Hospital. He focuses his clinical and research efforts on health equity and wellness for individuals and communities experiencing health disparities. In addition, Dr. Johnston is involved in addiction treatment, nutrition and food security, anti-racism efforts, care of homeless and housing insecure, and global health. Originally from Olympia, Washington, he completed all his medical training in Milwaukee. Thank you for joining today's session as our facilitator, Dr. Johnston. And with that, I will turn it over to you.
Thanks so much, Dr. Young, and the whole team for the community engagement side. It's just been tremendous in getting this together. But I'm really, really glad to be here with two people who are not only doing amazing work, but who are also just remarkable human beings. A lot of times when we talk about community engagement from the clinical perspective, there's a question about how to really actualize that connection between the clinic and the community. And this partnership that we'll talk about today is about as concrete of an example as you can get. The two people doing the work are really so critical for making it successful. And I'm always interested in learning about people doing work that they're clearly called to do. So Pastor Dan, maybe we can start with you. Can you tell us just a little more about yourself and how you came to be doing this work?
Yeah, thank you. I grew up in Milwaukee. We always had a garden in our backyard, but I really got excited to do this in my senior year in high school. And I took a class called plant science because I had to fill out electives, and really got interested in it. Then when I was a principal in Florida, we did some classroom gardens. Of course, that's a little easier in Florida because you plant in the fall and the kids are there to tend them the whole time, as opposed to here where they plant them and then they come back for the harvest. They get to see the whole thing. And gardened here in Milwaukee, and then this opportunity just sort of presented itself. We were listening, Mount Calvary has been listening to our neighbors for a long time on 53rd and Locust, and what we heard consistently, the themes we heard were fear about crime, people need jobs, and kids need something to do other than steal cars. So we really wanted to develop those interns. We say we're growing interns, and we use growing vegetables to do it. So we've had now, we're going to start our 4th class of interns this year, and we're excited to see we're going to have on board. And now we're really have learned enough to take that 6/10 of an acre we've got under cultivation and really be able to get quite a bit of production out of it. We've been giving the food to first the cafeteria at St. Joe's, and then to just Upstart Kitchen, Just One More Ministry, and a couple other places that I can't remember. So somebody asked how many interns we've had. We started with 5, and it was a little difficult keeping everyone busy. We're going to probably bring on 4 this year. So
I love that concept of growing interns as we grow food.
yeah.
And that really speaks to the impact of what you're doing and how that extends. So Jenny, same question. I always learned something new about your past, just like we did before the session opened, about your history and as a musician. But tell us about yourself and how you came to be doing what you're doing.
Thank you, Brian, and thank you, Stacy, for such a nice introduction. I feel so lucky, and this is like my 42nd year of being a nurse, and I like Dr. Johnston's analogy of growing things, because here at the residency, we kind of grow doctors here for 3 years. So when we're out at school, the kids love to hear that. But I've always been drawn to like holistic. I started out a lot in behavioral medicine, where, you know, I used music and cooking and exercise and like a real family holistic approach to people suffering from mental illness that were hospitalized inpatient for a long period of time. Kind of moved on to treating teens and people with eating disorders and all different kinds of things. And always along the way, it's been important to me to combine education and continuing just to learn and be challenged. And so about 22 years ago, I came upon this job when I met Sandy Olson. And this, I couldn't have actually ever dreamed of something that would be more perfect, not only to try to help improve parts of Milwaukee, but just also just light all my passions. I mean, if holistic medicine could be a Pinterest page, it would be having a garden and an exercise track, and then meeting Pastor Dan in the last 4 years, and all of us being able to work together. One lucky nurse.
Awesome. And one impressive Pinterest page also. So I'm really interested in that moment of, you know, you both coming together, because I think for a lot of clinics, if someone, you know, if a community partner came in and said, I've got this great idea, the community, you know, has this triad of needs that I think we can serve by making a farm. I think many clinics may not be so receptive to that. So walk me through how that you know, moment or that time was for you guys. We
had, even before we developed this idea, had been able to cultivate a relationship with St. Joseph's Hospital. I think the first week I was here, I met with their chaplains, and was later told no pastor in the community has ever done that. Come and actually come to the hospital and ask to meet with the chaplains. But it's literally 2 blocks away. I don't ever, if I go to St. Joe's to visit someone, I don't drive, because I'll drive 8 blocks to walk the 2 blocks, just the way it's configured. So, and I got to meet Kevin Kleesner, who was the CEO at the time, and then presented this idea to him, and he was able to help us secure a small plot of land right across from the emergency room on Burleigh Boulevard. We rent that for $10 a year. From a guy in the community who's very kind. We started developing that, and then he brought me over to meet the leader, CEO, I don't know what you call Sandy, director at All Saints at the Family Health Center. Well, it turns out she had been a member of Mount Calvary. Her son graduated from Mount Calvary. She taught Sunday school at Mount Calvary. She's at a different church now. So we hit it off, and I think they really gravitated toward this vision. They were already doing things there, and Jenny can tell you about that with their little school garden. This was just kind of an ability to move that ball further down the field.
Yeah, I agree. It's like, I think some of the things that are really neat is the people that you connect with and meet, and then you realize your passions are, they're not exactly the same, but there's a lot of ground that's similar. And one of the things is our ability to just dive in and do stuff. It's like we've been really fortunate to be given, being able to just try stuff and see how it works and not have a lot of lengthy red tape to follow. And we have these passions of wanting to make the community better. And the medical perspective and Pastor Dan's history, I think it's a really great woven piece of stuff that's never finished. It's always we're adding on to the quilt as we go along. And I just, it's changing all the time, but it's truly our passions meld together really well.
Mm. Tremendous. What do you think?
And they've been really good to our interns. Jenny brings them popsicles on a hot day, so they like having their kids around.
Yeah, the environment is so neat. People will, like they'd say to you, Pastor Dan, is what, well, nobody's ever done that. Is that the same thing as people are like, what kind of a nurse are you? And it's like, I don't even think of it as that, as I just think how fortunate it is that we have doctors here for 3 years and staff members that can go outside during their lunch break and chat with people like that wonderful human being, Keith, about what they're doing and share popsicles. And there's something about going outside and seeing that. That's the other side to all of this, is it's very unique. I can't imagine seeing this somewhere else. So it's really a wonderful thing for MCW to highlight, because people will always say to us, oh my gosh, I've just never imagined a medical clinic like that.
So, it's obviously a very, very unique situation, but it seems to be working quite well. And I came on after you all had started this already, and I was immediately struck about just the connection that Dan and Jenny and Sandy, and just like the two sides just really, really work well together. What are some things that you might be able to share with others who are pursuing community, clinician partnerships that help it work so well?
It's about relationships. It's always about relationships. And relationships are between human beings, not organizations. That, to me, I think was sort of the secret sauce in this, that we really connected early on. Jenny and Sandy will work in their little garden plot on their break time during the year. They enjoy this. And though I don't know that they'd be ready to run that BCS tractor you saw me behind in one of the slides, they like to see what's happening there.
I totally agree. It's like, again, our personalities, we all like trying things to push the passions ahead to help the community. And we're not afraid to try, and we're not afraid to fail or tweak things. That's the other thing about community medicine, is you have to be willing to give stuff a shot, because it doesn't always work the way you think, or you learn something new. And the other thing with the students that we get from MCW and everybody is we all share our gifts. And, I grew up in the Bluffs of Minnesota, being kind of, you grow up on the family plot and you have to do farm work, but I've learned so much from Pastor Dan. And, when he has medical questions, he has all the people here. So there's a lot of sharing, and it's really nice for everybody to be able, we all respect each other's gifts at the table.
Just add that Brian is my personal doctor, so we've got that relationship too. So I'll see him running on the track and I'll ask a question. So
yeah. And you've helped me learn about gardening and my own private garden as well. So it all comes back around.
Mm-hmm.
I want to turn to the learners that we're thinking about. So, and particularly thinking about how the Medical College of Wisconsin and the residents and the students that get to engage in this work and see this being modeled. What does that add to it for each of you?
Well, I can start, because Dr. Johnston and I were lucky enough to listen to the residents present some of their projects today. And what I've seen, and they're here for 3 years and they work on a community project to give back to. And the profound work that they've done, especially when we were listening, we're talking today about food insecurity and our partnership, and just identifying, what patients need. And during the pandemic, it's been magnified. And I think that the residents that are here get to experience not only walking outside and having the fun part where you've got this lovely green space, but then taking that and saying, how can I help my patients? How can I provide something as fundamental as seeing how we can improve somebody's ability to access food? Then we have the medical students that the third years, we have at least 2 to 3 third years every month, and we have first years that come and occasional every level, and they come to learn, but we also sometimes they will be an expert in something outdoors or on the farm, but they get to see before they get well into their practice how to really integrate social determinants of health, and how this is a perfect place for them to see the example of how to take care of the whole person on a community kind of level, because they get to see this, they can walk outside and see it, and we encourage them to be involved in all of this. In the summertime, they run the summer camp where the kids, every week when they come, they're part of the garden, and then they're cooking things. So they see Pastor Dan and the kids, and many of the kids then too want to know how they can be an intern. But I think the medical students and the residents seeing all of that, they're a gift that we get from MCW, and then they will go forward with this knowledge and just this experience and expand on it.
Yeah, we have one intern this year who he's going to go to college next year, and he wants to be a physical therapist. So hopeful that we can connect him with some folks in the clinic, maybe through Ascension or MCW's wider network, to maybe get a better understanding what that's like. Our second class of interns had a young lady who is now studying to be a nurse, and was able to, I think Abby talked to you, Jenny, and
Yep.
maybe some of your colleagues about, what is that like? Is this so there's there's a lot of ways to grow interns, and that's part of it is just connecting with people.
I love that. And Jenny, what are you seeing about, how the community side translates to the clinical side for, how do we carry this work with us into the clinical side, both for the learners and for the other clinicians?
Well, I think the first and fundamental thing, and the pandemic has made it harder, but is staying in touch with the community. So you have to get to either go out there and actually be present in the community, and that means going out there and having occasional focus group stakeholder meetings, looking at the citywide surveys, because one of the things we have to do is make sure we look at our surrounding area and listen to what the community says they need. And that was something I learned early on, is it isn't what I think coming from where I live and what class I think I should teach, but it's not that hard to survey the community, talk to patients, some of the feedback we learned from the residents today. So fundamentally, that's where it starts. And then offering things, if you want people to take care of their whole health, again, here we are where a doctor sees a patient and they need some help with food, or they need to exercise, and we have that all right here. So part of the idea right before the pandemic was that whole idea of a hub where we're way more than what people perceive as your basic medical care. We're providing, legal bus assistance, mental health services, because these are what people need to be healthier and to approach some of the, tackle some of the physical problems. All these other things have to be addressed. So that's how I see we have to fit with the community, and we literally have to be here for them in all those different ways.
I love that. Yeah, and grounding, the care we're providing in the community, and addressing these other needs that you can't do with a prescription pad, and what better way to see that in action than through involvement in this kind of work. Just really fantastic stuff. And yeah, it was so interesting and so timely. Jenny and I were talking a little bit about the cyclical nature of this, about kind of the circle of life of community work. And the residents were sharing about some food security screening that they had done in the clinic population, found that there was a fairly high prevalence of food insecurity. And then they followed up with some conversations with patients and asked, like, what kind of things are you interested in? Which I just love that process that they are going through there. And interestingly, we found that the most popular thing that they wanted was to learn how to grow food. So and that may not have been there if they hadn't, seen the farm, if they hadn't been aware of it, but they want to be part of this. And I just love that is resonating in the community.
Yeah, Pastor Dan, we just found that out today. I mean, really, people, one of the things highly that they want is to know more about the farm and how to do some of that themselves.
We'll see how that progresses.
Yeah. Yeah, that's the inputs are fairly simple. You need dirt, and Ascension has been very generous in supplying us with dirt, and dirt in our case in the right place. We had people say, well, I got 2 acres out here in Oconomowoc I'll let you use, or wherever, and our kids are from that community. Why ship them out 45 minutes out west, as lovely as Oconomowoc is, when they can just really get to that place? But dirt, sunlight, water, and plant, and you're off to the races. But to really maximize that, there are some really simple things you can do, and to understand the relationship of soil and inputs into soil that will provide a better outcome with the plants. It's not unlike your work in the medical field, inputs to get the outputs.
You make it sound so simple.
Yeah.
And maybe it is to some extent, but I think there's a lot more to it also, but having teachers along the way can be really helpful. It sounds like we have that, so a lot of good things to think about. So Dan, you mentioned something. I want to talk a little bit about impact that we're having, that you're seeing. And Dan, you said something in the chat that you were able to donate over 1,700 pounds of fresh vegetables last season. What does that mean in the community context that we're operating in?
Well, first of all, what that means for our interns is they have agency. They know what's going on in this community. They know how difficult it is in the city, but they're a part of something that's making it better. And I think it tells them, you can make it better. You don't have to throw up your hands and just say, oh, I can't do it. That you can be a part of making it better. Now, with Upstart, who got the majority of our produce last year, they are working with Ascension, and I think they're providing 100 diabetic meals a week, and Ascension gave them a grant to do that, and the outcomes were so good with those diabetic patients eating these meals that they re-upped them for another 3 months. And diabetes, I think, is relatively simple to monitor, and the numbers are pretty obvious when something's working, and this was working. So yeah, I think those are the pieces of it, that it has a trickle down effect, and then what it does for our interns to be a part of that is the part that's exciting for me.
Absolutely. And hearing Keith speak into that, I think in the beginning was really insightful and exciting. So Jenny, I think you got into this a little bit about the impact that we're seeing on the residents and the clinician side. But what about downstream? Like, what do you think that being involved in something like this does for physicians as they move into their careers out of training?
That's such a great question, because what I've heard more, and we had some new partners, some anesthesiology residents too. And when you talk to the doctors, it's a profound experience. It's almost like spiritual to help in that kind of way. And there's also the side of realizing and walking out of a patient room where one of the residents have come in and they stand and they're like, they've just tried to deal with a bunch of physical problems and they come for help because somebody doesn't have food and they've got another patient that they have to see. So the exposure, and also them learning that we have to take it apart piece by piece. It's a big responsibility, and there's help for, we can help them work through it, but to see just them be in touch with that, I think is number one. We can't always fix it right away, but we can share the process of what to do next and start laying the groundwork for what I think, we hope to see in the future, is that there's more of these ways to treat everything, especially in one place. So people like to be able to do as much as they can under a roof that's comforting, where they know people. And so I think we're going to see more of medicine going in this direction. But I think for them to experience that it's possible and they're not doing it alone, because I think for me, and I know for a lot, it has to be really difficult for a lot of the practitioners to walk out with these complicated problems.
Absolutely. Food security is an issue bigger than any of us and can feel overwhelming for clinicians to be part of. But I know from my experience in this residency program that the residents here get it and they know what to do about it, and they know about how to think about their community and how to connect to resources, and just the way that they talk with their patients about food and the way that they talk with their faculty, it's very advanced. And I absolutely see that resonating, whether they go to another clinic that has a farm or not, whether they go to a clinic that has this kind of partnership or not.
And somebody asked a question on the chat and said something about, it seems like it's such a big responsibility and how do you do it? And just to sum up what you're asking is, that's the thing, is it has to be a team approach. But one of the most important things with other places who have wanted to do this goes way back to Sandy making sure this grant position, it's been supported, by Ascension, and MCW's always supported it, but you have to have somebody who has the time to help do it. I imagine the residents being here and our patient population, when you have somebody you can run to that has the time dedicated to do all these sorts of things that go together into this one big thing, it's really helpful. Like, I have the time that I'm given to help Pastor Dan. I have the time to sit down and figure out how to get food to somebody if a doctor is worried. And yes, I can't do everything, but I think our clinic is a great example of why putting the resource there is really important.
That's a really powerful insight. Yeah, because the efficiency and the scalability of that kind of relationship and that kind of partnership is definitely something to consider. But even just that mindset and that openness, and that, the result of the collaboration may not have been a farm, it may have there's so many ways to interact with food security and those things that Pastor Dan had mentioned: crime, engaging youth, and jobs, and then combining those things with food, which we know to be a big need in the community as well. There's so many ways that could have an outlet. It doesn't have to just be a farm. It's great that that's happened in this case, but it doesn't always have to be. We've got a lot of really nice questions in the chat. I want to just pick out a couple of those now. So
and yes, somebody had asked about patient advisory, and patient advisory and shareholder meetings are really, there was a picture in the beginning of the slideshow of one of the times where we had everybody around the table, teachers, firefighters, parents, patients, neighbors, politicians sitting around to just see where the resources are so we don't duplicate things and we can learn what's needed next.
Absolutely. And Dan, can you speak into the choices you're making and what to grow year by year?
Yeah, we're really blessed. A former student of Mount Calvary is this chief financial officer at Ball Seeds in Chicago. So we've always gotten our seeds donated from them. This year, it's about $1,400 of seeds they've given us. And now that we've got the greenhouse, we can really maximize that. But you know, we've started with some basic things, but heard a lot of people at the markets want green tomatoes. We did a row of garlic last year. This year we did 3. We plant that in the fall at harvest in early summer. You know, so those are some of the things we've heard. I found out somebody with Ascension was able to get some research and found out what are culturally relevant vegetables for Afghan refugees. And many of them we were growing, but okra is one of them. And I've never grown okra before, but I've got about 400 okra seeds ready to go. And we'll give that a shot. And hopefully, certainly with the influx of Afghan refugees, there'll be a need that we'll be able to fill. So trying to understand culturally relevant vegetables, you know, collards, not kale, on 24th and Villard. They're about the same, you know, really. They're just a little somewhat different in flavor, but a strong flavor and a leafy green. But those are the kinds of things. And then what the soil will support. It's a pretty, we did pretty extensive soil testing before we started. The good news was no lead, which in an urban environment is always, you got to be on the watch for. Really very low lead levels in that soil that we tested. But a pretty heavy clay soil we're working on. We're adding a lot of organic matter. So every week I pick up 3 bags of spent grain from a little microbrew here in Wauwatosa, Stockhouse Brewery, and that goes on the ground, try to work that organic matter into the soil. So yeah, so part of it's what we can grow, and part of it's what we hear people wanting,
what the community's needing. Yeah, you're kind of doing your own, continuous community engagement loop there to learn about the impact and what to do next. And I love the okra idea. I think that may have come out of our conversation about how we're seeing more of the Afghani refugees coming through to do health screens at the clinic and having trouble finding the foods that they're used to eating. And I love that connection is possible. Now the other one I'm just thinking about was the pumpkin patch.
Oh,
right? Do you want to mention that, Jenny, a little bit?
Well, what was great about our trunk or treat is Pastor Dan grew all the pumpkins, and so the families were so happy that they could pick out. We made a little patch with some bales of hay in the front, and that was just, you saw one of the pictures of the family sitting on the hay bales. So they not only could take a family picture, but take a pumpkin home. And Pastor Dan has got, are you going to grow a giant pumpkins this year? And
I've got some seeds for a giant pumpkin. Yeah, we're going to try it in the greenhouse just for fun. One of the, 200 pounders.
And I saw a question that's really neat, and it's something I love to do, is how do patients get involved? Do they actually come out to the garden? And when the weather gets nice, our exercise classes, this is one thing the pandemic, maybe that was a good thing, is we pushed all our classes outdoors. And since we have this gorgeous green space, we did our yoga and our low impact aerobics around the small garden area. And then there was always bags available, and people would take vegetables. And we have like a lot of herb things like basil, mint, things to make tea with. And Kelsey, the dietitian here, would put some recipes together that were easy. So people could literally see their doctor, maybe exercise with their doctor, because a lot of times the doctors will come out, or we might see Dr. Johnston running around the track. And then they get to take some vegetables home with the recipe and come back later. And when the pandemic is over, then we can resort back to cooking classes where people can get some vegetables and we actually cook them all together. So we do try to encourage, and it sounds like people want to have more interaction with the farm. So that's one direction that will be something we can, irrigate, so to speak, and make that work.
Yeah, and if things go as well in the greenhouse, this is the first spring we've had the greenhouse really. If things go as well as I believe they can, we could very well have some seedlings to, some little plants for people to try in their backyard, those kinds of things.
It's year by year, it seems to be evolving this process, and that's part of the fun of it, I think, at least from what I've seen.
And Pastor Dan tries to take a little bit more land each year.
I do my best.
There was a really interesting question about how are we evaluating the impact of the program and centering equity as well in that process. I wonder what either of you might respond to that.
We have every year had a kind of a year-end party with our board and our intern class that year. And it's been in my house, and we've, I like to smoke meat, so I smoke some pork shoulder, and we, make some salads, and kids come over, and each board member will talk to one kid with a kind of a script and try to tease out from them what they gain from this each year. That's one thing. This year, we're going to add a new capstone project. We're going to ask each intern toward the end of the season to prepare a meal for some invited guests. So Dr. Johnston, you may get invited to that, and then kind of just talk about the vegetables as they prepare them, with produce from our garden, with some other things that we'll get.
And some of the things are really, it's not fancy at all. Pastor Dan will have an excess of something, and he makes up bags with the interns for me. And I literally go out into the lobby and into the patient rooms and ask the nurses who's there. And I walk in and chat and ask people if they'd like some vegetables and show them what we have, put a recipe in the bag, and make sure that, number one, the food doesn't go to waste that Pastor Dan has, but that if somebody gets a bag, one thing I learned is not everybody, they want it, but they may not know, and maybe they don't want to ask, well, what do I do with this? So I always just kind of mention something that would be great. And the light up that people have when you give them some fresh vegetables, and also then just tell them, did you know there's a farm behind our clinic? Because a lot of people, the farm is behind the clinic. So if you walk in to go to the doctor, you might miss it. And our community members, when we get together, unless we know them, they don't know there's a farm back here in a greenhouse either.
Excellent. Well, what's next for this project? Where do you see this going? What's the grand vision here?
I think on our side, that what we need to do better this year and in coming years is have a better structured curriculum for the interns. That the development, that we put more experiences in there. If anybody wants to help us with mock interviews or some of those things, we're gonna do that. Help them with their interviewing skills. If you got a little bit of an HR bent, they're going to come with me to the markets a little more this year than we have in the past. And then that capstone with preparing the meal. Talk a little bit more about self-regulation for them, because if you knew their backstories, you would understand that self-regulation is more of a challenge when you grow up in some of the home situations and neighborhoods that they do. Somebody said they'd help with mock interviews. Email me offline here, so I'll just put my email in the chat here.
And I would say, in terms of the medical stuff, is that we have every year, new residents coming in, and that means new projects. And when we were talking a few minutes ago about surveying, is maybe doing a little bit more work and getting some questionnaires out and finding out if there's what we're doing and what patients feel and community members, and could we do something different? What do they need? We got some information that people want to have cooking classes. So what would they like to cook? We have a lot of refugee populations that maybe we could do some learning and sharing with refugee recipes. And because of our environment, there's a never ending. I mean, there's so many things we could do. But one of the exciting MCW things came out of the anesthesiology department, and they started partnering with the residents coming over and actually working and helping Pastor Dan, but partnering with our family docs and talking about what the community is like for the patients that they're putting to sleep on over, on the other side of town. And that was just a surprisingly wonderful. And that's going to actually expand to maybe ER docs and surgeons too. So here we are over here being able to share that with a whole nother group of residents, and our family practice residents or family medicine residents get to interact, and we get to share back and forth. So I think that's going to be a really exciting thing in the future for us.
That's awesome. And that program is so interesting. It's not the first thing you think about. Anesthesiologists, get into the community. I mean, they're working with people when they're, in twilight and going to sleep and on the other side of that. But when you think about it, there is so much to learn and that can influence the care you provide when you understand where someone's coming from, where they're going to, what are the challenges along the way, and what are the resources along the way too. And a community engaged anesthesiologist is absolutely possible and is absolutely has a lot of potential, I think. So I think that's just a beautiful example of the power of this kind of work in engaging medical learners.
Well, in all the partnerships, Pastor Dan talked about, it's all about relationships. Well, somehow they found you. You asked me, Dr. Fairbanks and Dr. Zindel sent over, all these people that we got to meet. And it was everything that we talked about today coming together, and now it's going to get bigger, which means there's more exposure, more patients that will benefit, more food that can be picked. Pastor Dan gets more help. People learn, we learn from them, they learn from us. And that's kind of what this all means to me.
It's awesome. And I saw that you got 25,000 pounds of horse manure. So as we get more residents, we'll try to time them with that delivery next time.
Yeah.
That happened that one day when they showed up. I got lots of great pictures of them shoveling all of that for Pastor Dan.
So as we head towards kind of wrapping things up, what calls for action, I guess, do you have for the audience? What opportunities are there for those listening here? We mentioned the mock interviews, but how can people get involved in this?
Well, we're always looking for volunteers. We have received some grant money that mostly we put into infrastructure and but we rely on donations to pay the interns. And I said this before, and I think it just rolled off my head, but I really am pretty convinced of this. There is a dignity to work. There is empowerment in a paycheck. And in our particular work, I think there's something that's emotionally gratifying, that's psychologically fulfilling, that's even spiritual in putting your hands in the soil and making and helping plants to grow and making it possible for plants to grow. So I think that that's the really neat part about our interns. I think it's great for them to meet a variety of people so that they could meet an anesthesiologist, which probably they never would. Not just one, a whole flock of them coming out there to the farm and that kind of thing. And some of the other connections we've been able to make, that those are really worthwhile. That's a really big call to action. We're glad to have volunteers. We're looking for somebody wants to have some dietetic technician students doing cooking classes. That's cool. Be kind of cool to do some YouTube videos of cooking, and then you could just put a QR code on the recipe and actually watch it happen, because everybody learns how to do everything now on YouTube. Those are some, some areas where it could get some help. That might be, if getting in the soil or being out in the sun is not your thing.
Yeah, I'd be if hopefully our emails are available, because that would be something with dietitian students or dietetics too, that we would certainly welcome. And all I have to add to all of what you said, Pastor Dan, which I agree with all of it, is that whatever inspires people. Some people may be curious and you just want to come and see our place. And I love showing people around. I love, being able to make you some food or have you come by and see what we're doing, or come see an exercise class, come watch the kids and hand out some popsicles. Is I like the contact with people one-on-one. I love to show them what's right in the middle of our city, which is such a treasure. So I would say whatever inspires you. Some people like to volunteer. Some people have money to donate. Some people, it inspires them to get politically involved in making sure our community is a safer place for people. So whatever makes you inspired.
Yeah, I think we'll have another spring open house just to bring community people in. That's not, it's not like a gala or something where we raise funds. It's a chance, although we'll give you the opportunity to contribute if you want. But we, just to see it. And I know we had some guy connected with Mount Calvary who came out. I'd seen him at a funeral, oddly enough, and I said, yeah, come on out. And he did, and he was like just wowed that we were a part of that. Just thrilled to see that in action.
Well, and this is our 50th anniversary. So hopefully this year we will have a celebration, because there's a lot of practicing doctors that have gone out all over that would probably love to see what this place has become and all the potential it has to keep blossoming.
And I think, Pastor Jan, from your side, the same thing seems to be the case on the medical side too, where people that come are wowed by what is there. I mean, I'm wowed every time I come to work here. So last question, we got a couple minutes left. Is this a direction that medicine and medical training should evolve into?
Well,
I think go ahead, Pastor Dan.
What you've got all the school. What difference does diet make in health outcomes? What difference do health? I mean, there's only so much you can do in a half an hour visit. It's the other, rest of the year that you see somebody. If you can move the needle on somebody's diet, that's huge for what you do.
And I also think it's always great to highlight the mental health benefits that go with nature, outdoors, farming, and eating healthy and exercising. It's like what we have here is all those things combined, and we are continuing to try to make that bigger and bigger, so that, all the things that keep us healthy as humans, we can share and do in one place. And that's how doctors are learning to care for people. And that's really what I think it's all about. And we have the lovely space here to be able to do all of that. So it's our responsibility to do it.
Yeah. The mental health piece, I came across this, and if somebody in the chat knows what it is, but there's an organization that was established after World War I. It's over 100 years old. It's still operating. And it was about connecting veterans of the war to gardening. Because so many veterans came back from the war with what they called at the time shell shock, or we might call PTSD, and they found that the outcomes for that, certainly not for everybody, but the outcomes for many of those veterans were pretty exceptional. When psychology was very much in its infancy, I would say.
That's awesome. Yeah, I'm reminded of Hippocrates, who we recite, the Hippocratic Oath when we become doctors. And he also said, let thy food be thy medicine, and let thy medicine be thy food. And I think that in so many ways that continues to be true. Well, we want to make sure to respect everyone's time. And I think we have a couple wrap up slides here just at the end. I've really, really enjoyed this conversation. I just want to thank you both so much for being here and sharing your wisdoms and sharing your good work. And I think we had like a, yep, there we go. So I think this is a QR code, Pastor Dan, if I'm right, for any support for the work that you all are doing. But yeah, I'll join you all in putting my email in the chat if anyone would like to, you know, have follow-up conversations or further you know, collaboration around these areas. Just really welcome it and really appreciate the time. So with that, we'll leave you a couple minutes early. We'll stick around, you know, if anyone has anything they wanna bring. But thank you for the time and really appreciate everyone.
Thank you.
Thank you.
Thank you.